Guru Nation, how's it going? Look, it was such a busy day at the clinic today. Let me tell you why it was busy, and let me tell you why being a coordinator is not so easy as it seems, and why, when you are a site owner, you should really be the ones to get your hands dirty initially, and why, if you're a potential coordinator, you should pay attention to these things before you start working, or if you're maybe a research assistant. So, I spent 4 hours today at the site pre-screening a patient. And you might ask yourself, why in the world would anyone ever do that? You don't get paid for pre-screenings. That's number one and two and three, and all the reasons right there not to do it. But you also can't know if somebody's gonna qualify unless you pre-screen them. So what happened? The doctor, my PI, referred the patient to me. The patient has a long list of medications, so I spent about 30 minutes with the patient. I actually asked the patient to come in, and I spent 30 minutes with him going over his medications, going over his medical history, literally line by line, just to confirm with what he's saying is what is on the medical records. I'm glad I did that because one of the medications that requires a 3-month washout period, he actually is not taking. Even though the medical record said he's prescribed that, he hasn't been taking that. And matter of fact, if I look closer in the records, I can see that what he says is true because I confirmed it with another medication he's taking, which nobody would take both of those medications at the same time. So big right there. That was worth just him coming in. Then he left. He only took half an hour of his time. I said, look, I'm going to go through the rest of your records. If everything looks good, I'm going to have you come in Friday or Monday. We already scheduled his screening, and I put it in Creo, so we have it. He's good to go. But the next 3 hours I spent at my desk going through his medical history, going line by line through his conditions. He has a few different diagnoses. Going line by line through the medications, comparing both of those things, the medical history and the medication list, to the inclusion exclusion criteria. And believe me, I wish I can show you this study. It's extensive exclusion criteria. And everything's written in a way which really relies on the PI's best judgment and opinion on what should happen. Now, the way the IE criteria is written leaves some wiggle room. So they say, well, these conditions are excluded, but it doesn't mean that if they have a condition that's excluded, as long as it's not severe, they're okay. The IE criteria has a lot of this kind of stuff where it's like tricky, it's a little bit vague, and it really leaves it to the discretion of the PI. So I talked to the PI. He confirmed that he's a good candidate still. I then emailed the medical monitor just to be on the safe side. I said, "Look, we have a patient, but these are the issues. What do you think?" And the medical monitor was really helpful. He replied back immediately and said, "Well, it looks like it's not necessarily an exclusion criteria. So if the PI feels the patient's a good candidate, go ahead and screen. Just watch out for some of the other things, maybe some of the other symptoms they're presenting." So I didn't do that like in a few minutes. This took 3 hours to do, an hour for the meds, an hour for the medical history, and probably another hour or so to gather everything initially, and then to present everything to my PI and to the medical monitor separately. And then they call the patient and schedule them to come in. Hey, good news. Looks like you qualify, at least qualify enough to do a screening visit. Please come in, and then we'll talk about which medications you've got to wash off from and all that stuff. So the point of all this is people think pre-screening, well, that's not important. It's just you're calling to see if they qualify for a study. If you do pre-screening the right way, and this is why I'm telling you site owners, you new site owners, before you delegate this to a staff member, make sure you understand the process for every study because there's always tricks, there are always nuances, and we're looking to hire our first employee, and our first coordinator employee, and I'm going to be training her on exactly everything I did today and these last few weeks leading up to her hire, because I already know the pitfalls. And another thing, if you do the pre-screening properly, your screening visit's going to be so much easier. Why? Because I essentially already went through all the inclusion exclusion criteria, at least as far as medication and medical history. And so now the only IE criteria left is the ECG and a couple other assessments that you have to do at screening. So I think the most difficult part of the actual screening and randomization is making sure all the inclusion exclusion criteria is met. And I basically spent 3 hours, maybe 4 hours if you include when the patient was with me, doing that to make sure that my screening visit on Friday will go smoothly. And guess what? Because of that, and my business partner Jaime Avaya is basically doing the same thing for another patient, we're going to screen both of them on Friday because we've done most of the heavy lifting already. It's just a matter of doing the actual visit now. So just wanted to make a quick video for Guru Nation on this pre-screening and why being a coordinator is not as easy as it seems. Thank you so much, Guru Nation. Good luck.